Measles Virus and Cancer, a not yet exhausted saga, by Professor Daniel Benharroch, Beersheba, Israel. History. Viruses, bacteria, and parasites are linked to human cancer in about 15% of cases. The organism may be related to a limited set of changes in the initiation or progression of the cancer. The precise connection might not be elucidated, owing to the time lapse from the original infection. In some cases of chronic inflammation, the immune response might deteriorate, promoting transformation. Regeneration sustains cell survival, tissue plasticity, and angiogenesis. Classic Hodgkin lymphoma, subsequently termed hodgkin, is a malignant tumor of the immune system which carries a generally good prognosis. It occurs most frequently in young adults. Few tumor cells, the Hodgkin and Reed-Sternberg (HRS) cells, are identified in the lymph node section. Tumor (HRS) cells express Epstein-Barr virus (EBV) related antigens in the cytoplasm. In Hodgkin, EBV expression varies from 17% in developed countries to 100% in some developing countries. EBV expression is more frequent in males and in mixed cellularity Hodgkin. In Hodgkin, EBV activates NF-kappa B and EBV LMP1 increases apoptosis resistance. EBV expression outlines 4 curves of Hodgkin incidence by age and gender. The most prominent concerns young adults with nodular sclerosis Hodgkin and negative EBV expression in the West. A tiny curve concealed within the above curve represents young adults following infectious mononucleosis. A minor curve depicts male children with mixed cellularity, EBV positivity from developing countries. The 4th curve describes older adults with EBV positive, mixed cellularity Hodgkin. Thus, EBV probably accounts for a minority of Hodgkin in Western countries. These are young adults, including most women with Hodgkin. Those most expected to present with a late exposure to a common infection are mainly nodular sclerosis and EBV negative. The reasons why the measles virus, MV, was proposed as a possible candidate for an association with Hodgkin follow. MV is lymphotropic, with additional tropism for the oropharynx. Transient immune cellular deficiency often follow the MV infection. Multinucleated cells are observed in the tissues. Since the introduction of the anti-MV vaccination, more children are diagnosed after age 5. Therefore, we have proposed a candidacy of the MV as a possible agent in Hodgkin, although this virus has never been considered as oncogenic. Methods. 154 biopsies from untreated Hodgkin patients were studied by immunohistochemistry, IHC. In a proportion of cases, a reverse transcriptase polymerase chain reaction, RT-PCR, was carried out on total RNA. A southern blot was performed on the products of the nested PCR. In situ hybridization, ISH, was then carried out. Last, clinical pathological correlation was performed. Results. The photomicrographs depict IHC of a negative control, left, and positive staining with different antinucleoprotein MV antibodies, right. Immunostains with 2 different antihemagglutinin MV antibodies, top, as well as immunostains for matrix and phosphoprotein MV antibodies, bottom. Southern blot with products of the nested PCR of RT-PCR, top, depicts several bands of hemagglutinin MV RNA in Hodgkin. A few bands of nucleoprotein MV RNA, middle, for Hodgkin cases, but no positivity for MV antigens in non-Hodgkin lymphomas, lower. Micrographs showing ISH positive and negative controls, top. A HRS cell is stained for hemagglutinin MV RNA, bottom left, and several HRS cells stained for nucleoprotein MV RNA, bottom right. Provisional results. IHC. 82, 54%, of the cases are positive for 2 or more MV antigens. Southern blot. 4 out of 15 are positive for hemagglutinin MV RNA. 2 out of 12 are positive for nucleoprotein mVRNA. ISH. 2 out of 7 are positive for hemagglutinin mVRNA. 8 out of 21 are positive for nucleoprotein mVRNA. Clinical correlations. Association between positive MV expression and female gender, nodular sclerosis type. Relation between negative MV expression, negative CD15, and negative P53 expressions. Association between combined MV+, LMP-, and nodular sclerosis type. Early stages. BCL2 positive expression, MDM2 positive expression, and apoptotic index less than median. A multivariate logistic regression model, 89 patients dying of Hodgkin, stage 4, carries a times 13.67 risk of dying of Hodgkin when compared with other stages. The complex MV+, LMP- carries a times 10.05 risk of dying of Hodgkin when compared with other combinations of the two viruses. The MV-, LMP- complex carries a times 15.2 risk of dying of Hodgkin as compared with other combinations. Preliminary comments. Hodgkin is associated with a MV expression, but with no evidence of causality at this stage. This link is sustained by the occurrence of brain, spinal cord tumors, and Hodgkin after exposure to measles around birth. The regression of Hodgkin has been described following measles. Measles and other childhood infections may protect from Hodgkin. Whereas female patients, nodular sclerosis Hodgkin and early stages carry usually a good prognosis. Their association with MV expression will transform them into poor prognostic factors. Isolated positive MV expression and negative expression of both MV and EBV are poor independent prognostic factors. The longest survival is linked with a positive co-expression of the two viruses. The German connection. To evaluate the pertinence of our thesis, Maggio, Coopers, et al. Chose 18 out of 44 of their own Hodgkin frozen tissues for their high-quality RNA and for their strictly classical Hodgkin and Reed-Sternberg HRS tumor cells. About 100 microdissected tumor cells were obtained for each experiment. RNA was extracted and RT-PCR was performed with primers from 3 MV genes. None of the 18 German cases were positive for any of the 3 MV viral transcripts. Hodgkin-derived various cell lines were all negative for mVRNAs. The Israeli connection. 22 of our frozen Hodgkin tissues, chosen for their MV antigen positive expression, were sent to Germany. Only 7 were selected, and they were found by Maggio et al. To be negative for mVRNA. Immunostains of 5 out of 12 German cases performed in Israel released MV positivity. A similar discrepancy had been noted before in favor of IHC. Commentary on the debate. In Essen, fewer and highly selective cases have been studied with more sophisticated methods. Our study had suggested low abundance mVRNA due mainly to various levels of ribonuclease from the eosinophils. Thus, GAPDH is probably inadequate for these experiments. Moreover, the 7 cases contributed by us were MC Hodgkin and EBV positive. 5 of them analyzed in Israel were either faint, 2, or negative, 3, for mVRNA. MV proteins have previously been shown to react with and stabilize the PER2 protein, an ubiquitin E3 ligase, by preventing its ubiquitination. PER2 is described as a negative regulator of P53. MV association with other tumors. 1. Endometrial carcinoma, EC. 49 cases, 36 with follow-up. 26 out of 36, 72%, expressed MV antigens, mainly type IEC. 16 out of 21 demonstrated MV RNA by ISH. In cases of type 2 EC, if MV positive, they carried a worse prognosis. Figures 1 and 2, EC with positive MV immunostains. Figure 3, ISH positive for mVRNA. Figure 4, Non-tumoral endometrium is positive by ISH. Lung cancer and MV expression. PER2 is known to be expressed in lung cancer, where it inhibits p53. Moreover, MVP protein inhibits the function of PER2. Thus, we investigated 65 non-small cell lung cancers. 54 out of 65 were positive for MV antigens and associated with older age, with positive PER2 expression and with improved survival. Breast cancer and MV. 64% of the 131 cases of breast cancer showed positive MV expression associated with ER expression, with Ki67 less than 40%. With low and intermediate grades, with age less than 50, with p53 overexpression. Melanoma and MV expression. MP, MV, and PER2 are expressed similarly in melanoma, with a majority of positive expression. Benign melanocytic nevi express predominantly NP, MV, and PER2. In our limited experience, non-Hodgkin lymphomas are predominantly negative for MV expression. However, ALK-positive anaplastic large cell lymphomas express MV antigens as a rule. Other tumors negative for MV expression. Seminomas, glioblastomas, mesotheliomas. In addition, Merkel cell tumor, hepatocellular carcinoma, few samples. Apoptosis of the HRS tumor cells in Hodgkin suggests a mechanism involving the measles virus. A consensus view has suggested a role for the apoptosis arrest in Hodgkin, involving NF-kappa B and LMP-EBV, but apparently relevant mainly in association with the EBV expression. This revision highlighted a mechanism based on MV expression. Thus, apoptosis inhibition was evident in 55% of the 217 cases only. It is also suggested that P65 and LMP-EBV are not associated with apoptosis in this cohort. Positive MV expression is related with the following: an apoptotic index inferior with the median, MDM2 positive expression, IKB positive expression, but predominantly with a negative expression of P35. Apoptosis and conclusions. Viruses have a tendency to modulate apoptosis in the infected cell for their own need. A pathogen mechanism is hereby proposed, involving MV and Hodgkin, distinctly or in combination with that used by the EBV, possibly in an opposite direction. It is hypothesized that an interaction between the two viruses may favor at the initiation phase a preeminence of apoptosis arrest, to be later replaced by apoptosis enhancement. This hypothesis may sustain the findings that both variations were observed in our cohort of Hodgkin. The association of MV with different types of malignancy might mobilize different mechanisms. Thus far, clues may be available for Hodgkin only. The rising incidence of this malignancy, at least in Quebec, Connecticut, and Israel, has been related with frequent outbursts of measles, as well as with the reluctance of many parents in the West to vaccinate their children. Recently, support for our findings on MV association with lung cancer has been depicted by a Western blot study on 18 non-small cell lung cancer frozen tissues. Here, tumor tissues were positive for a phosphoprotein MV antibody, while remote fragments of non-neoplastic lung tissue were unexpectedly PMV positive. Using the same antibody, we performed a tissue microarray encompassing 4 organs' malignant tumors, which showed in their majority MV expression, mainly in the nucleus. Shuttling of MV antigens from nucleus to cytoplasm has been described previously. The atypical measles syndrome is rare, differs markedly from measles, and involves immune complexes. It is most probably related in its pathogenesis with immune waning and exposure to a wild-type MV. An association with persistent MV infection is probable. A subsequent link with carcinogenesis should be excluded. I thank warmly my several collaborators for their help during the many years of this investigation: Professor Samuel Ariad, Professor Martin Sachs, Professor Jonat Schirmer-Avni, Dr. Yi Myint, Dr. Irina Klinkovich, Professor Bracha Rager, Eugenia Medzirovsky, Professor Jacob Kopas.